Hi, I'm Meg Laporte with Provider Magazine at the AHCA NCAL convention in Phoenix, Arizona, and I'm at the Optum CarePlus booth in the exhibit hall, and I'm talking to Dr. Ron Shumacher, who is Chief Medical Officer with Optum CarePlus. Could you tell us about Optum CarePlus, which has been known in the long-term care industry as Evercare for a long time?
Right, that's correct. We recently rebranded the program to Optum CarePlus. We are a provider-led care management and care delivery organization. We provide care to over 34,000 skilled nursing facility residents in about over 1,100 skilled nursing facilities. We do that with nurse practitioners who go in and see patients right at the bedside. We're able to reduce hospitalizations by providing proactive care to these patients. These are typically patients who are very vulnerable and don't do particularly well when they're hospitalized. So we try to treat them in place as much as possible. Typically, patients in our population, there's about 40% or more of our patients who have some degree of dementia. And so those are patients who, as an example, typically find a hospitalization or a transfer out of the skilled nursing facility to be a very traumatic and stressful event for them. Mm-hmm. And that's why we go in, and our nurse practitioners use very well-established evidence-based clinical protocols to treat them in place. But they also, while they're doing that, communicate very closely with the patients, with the families, with the physicians, the primary care physicians, who we're not displacing at all. We're working collaboratively with them. And by doing all that, we're actually able to prevent hospitalizations. One of the things we talk about is a sort of three-pillared approach, which is routine visits. We see these patients at least monthly on a routine basis, whether they need to be seen or not. The second pillar would be urgent visits. So we're available 24/7. And if we're called in, unlike your typical skilled nursing facility with a primary care physician who may be very busy and not available to come right in, our nurse practitioners go right to the bedside, conduct an urgent history and physical examination. They'll do advanced care planning at the bedside, all the things they need to do to prevent a hospitalization.
And are the nurse practitioners local? Do they serve several facilities within one area? Is that
Yes, we have nurse practitioners on the ground in every market that we operate in. And the nurse practitioners typically have a smaller caseload than a physician would have. And they also see patients usually in like one or two nursing facilities. So that way they can establish really good relationships and spend time with their patients. They have time to communicate and collaborate with the staff and with the physicians. And it makes for a very good model where they can get a lot accomplished because they're very focused on the patients that they're caring for.
And how many nursing homes did you say you were in?
Over 1,100 across the country.
Oh, great, okay. And so I understand you have a new white paper that you just published?
We do. And basically what happened is we worked with an external objective third-party firm that did some research for us. And what they were looking at is it's pretty well known that our model has been very successful for many years in reducing hospitalizations in this population. But what the research firm looked at is what is the financial impact on skilled nursing facilities. Mm-hmm. And they really found three important things. Number one, that the revenue that comes into the skilled nursing facility is actually, if anything, increased with this model. And that's because patients stay in the beds longer, and so that Medicaid reimbursement is typically reimbursed in full to the nursing homes because patients are in the beds. Mm-hmm. Secondly, because we're able to waive the 3-day hospital stay requirement that's required under Medicare.
Oh, okay.
We can actually skill patients right in their beds, right where they are. If we see a change in condition or an acute situation, we put them on a skilled benefit right away. And so the facility then is getting reimbursed with on a skilled benefit, Medicare rates, for someone that they certainly can take care of in the facility, but a lot of times they're not really incentivized to do that because of the way the traditional system is set up. And then the other thing is that the research firm also noted that care actually improves for these patients. When you look at quality metrics and other measures of quality in the nursing facility, that these patients are actually getting great care. So it's really a win-win for the patients, for the nursing facility, and for all of the stakeholders in taking care of those patients.
Excellent. Thank you. Thank you very much.
You're very welcome.